I just got home. Oh, do I feel better physically? Absolutely not. I am so tired. But do I feel better mentally? Yes. I talked to my nurse practitioner. I didn't see the oncologist today. I saw her nurse practitioner who is just as sweet as pie. But anyways, she said that my numbers look great because I did try poking around in my chart and googling my numbers, and I'm not a doctor. I don't know what I'm looking at. But she said for where I'm at in my journey, she said my numbers look great. She's very happy with my numbers. So I did get another Keytruda infusion today. She is saying that I'm at the end of my Keytruda chapter, my journey, that she's not surprised that I'm fatigued. Keytruda can cause fatigue. So now I've only got 3 more to go. Last one's in January. I'm just gonna keep trucking till I can't truck no more. I asked her about eyelashes, and she did her little beep beep boop bop, not regular Google, but like Doctor Google, and she couldn't find anything with Pembro or Keytruda on eyelashes falling out. So we're thinking it's like the growth cycle from chemo. I did finally remember to ask about chemo, so I asked her how long chemo generally stays in your system, and she said for the average person it's about 4 to 8 weeks. So that's good. I guess the chemo is technically out of my system. It's just dealing with my eyelashes getting back on track. She recommended trying like a lash serum. She didn't have any recommendations on what one, but I might give that a go. As for the fatigue, to try to get my energy back up, she recommended I try to get more activity in my life, which we both laughed at because she was like, I know when you don't feel good, you don't want to do things. But she said, for example, if you have the most energy in the morning, try to go for like a 20-minute walk or try something like Pilates. So I'm going to Google that because I've never done Pilates. And she is so freaking sweet. She came in carrying this, and I didn't want to like assume it was for me because, she's a doctor and I'm a patient. She said, I had to get it for you when I saw it. She goes, it's not much, but it made me think of you. Freaking look at this! With little chopsticks. It's a little... I thought it said cereal bowl. It says ceramic bowl with chopsticks. I was like, this is not a cereal bowl with chopsticks. It's a little ceramic bowl with chopsticks because you can't see it now, I have a whole Hello Kitty Sanrio sleeve. And when she saw this, it made her think of me. And she goes, I don't do this for any of my other patients. So she goes, so don't tell anybody. So I'm not going to name names, but thank you so much if you happen to see this. That was really sweet and it really made my day and I really needed that. So thank you so much. Now I just got to hide it from my daughter because she's totally going to steal this, but that was so nice. I did also talk to my infusion nurse, and I was just venting my frustrations and seeing if she had any advice because I'm like, dude, I'm like 6 months post chemo and I was feeling pretty good, and then now I am really struggling energy wise this last month. And I found out yesterday that if I don't go back to work in January, I'm going to possibly lose my benefits. And Lord knows I need my freaking benefits right now. Yeah, on top of that, like my last immunotherapy is January 18th, like in the middle of the month. And then if it continues to be like this, I'm going to need some time to recover. She reminded me that yes, I am done with chemo, but I am still in cancer treatment, and that immunotherapy is no walk in the park. And there is like a questionnaire, a sheet of paper that I have to fill out every time I get immunotherapy, and it asks all these yes or no questions. Are you short of breath? Have you had a rash? Have you had heart palpitations? Like it is a 2-page questionnaire, and I've always just filled it out and never thought twice about it, but it's because immunotherapy is still a drug and it still affects our bodies. So she just reminded me to be gentle to myself. Yeah, I'm being my own worst enemy, and so I just need to keep that in the back of my mind that I am still technically a cancer patient with like what, 4 eyelashes now? Okay, I'm kidding. I'm exaggerating, but still, I just have to remind myself that I am still in treatment and I need to be gentle to myself. But yeah, there's what I found out today. So now I got to go inside and call HR and touch base with them. Okay, so I love you guys. Be kind to yourselves. Don't be like me. And I'll talk to you later. Okay, bye.